Hi, this is Dr. Don Selby with a message for you about house calls for your convenience. We do make house calls when the circumstances are correct. We understand that sometimes you just don't want to go out in public. Maybe you don't want to get dressed up. Maybe you are feeling a little bit too weak. You're a little bit unsure of yourself. So here are your options. You can go out in public anyhow, come to the office. We can try telemedicine. We'll talk about that in just a second, or I can make a house call and we'll explain more about that. But here's some advice from us. If you are too weak to come to the medical office, you're too weak to drive yourself, you're too weak to ride in a car if somebody else brings you to the office, don't come to the office. This is not the right place for you. If you are concerned that you might lose consciousness while you are en route to the office or while you're at the office, don't come see us. This is when you need to call 911 and get to a hospital. If you think you have been exposed to a serious infectious respiratory disease, such as influenza or perhaps the coronavirus, please don't come to our office. We do not need you to infect us, the staff members, the other patients that are in the waiting room. You also probably don't understand the level of disinfecting, the time that goes into cleaning the office after you've been there. So please do us all a favor. Don't come in if you've got one of those serious infectious diseases. This is when we can make other arrangements. So here are your options if you're not coming into the office. One is telemedicine. That works well sometimes with some patients under some circumstances. This uses technologies such as FaceTime, Skype, Zoom, GoToMeeting, or some of the others where we can talk to you, but we can't examine you. We can't find out what your temperature is. We can't see how you're breathing. We can't listen to your heart or your lungs. We can only talk to you and have you describe what's going on for us. So that might work under certain circumstances. It's not our favorite thing to do, but it can work in a pinch. House calls are rare. Very few doctors like to do house calls anymore, but we do them when it's necessary. We'll come to your residence, we'll perform and evaluate you and see if we can come up with some kind of a treatment plan that's going to be reasonable. This works best for things like acute pain. We can treat you with an injection. By the way, if you are allergic to needles, we can use a very small needle and have you turn away, and maybe it won't be too bad for you. If you have a severe and chronic pain, or for some other circumstance, you need medical marijuana certification, sometimes we can do that remotely at your residence. We'll talk about in another presentation all the things that we need for medical marijuana certification, and you can see that it may not be something that you have available there at your residence. We can treat certain other diseases. For example, if you're having a difficult time breathing, we can listen to your heart and lungs. We can check your eyes, ears, nose, throat, etc. We can check joints. We can even do an EKG if we need to, and we can come up with some idea of what's going on with you. The treatment might be go to the emergency department, or the treatment might be let's get a prescription for you. But we don't know that until we do the evaluation. So in a lot of ways, that's just like being in the office. The third broad categories for house calls is when we're doing something preventive for you. So we can, for example, do vitamin or nutrient IVs. Sometimes this is referred to as a Myers cocktail. It takes about 30 to 45 minutes to run an IV in, and sometimes you feel really good afterwards. If you're dragging, you think that you've got the early stages of an illness, this might be a good time for a nutrient IV. Just bear in mind that we keep a limited number of them on hand in the office. We don't get to make them up. We have to buy them from a compounding pharmacy, and it usually takes a couple of days for them to get into us. So it might be that we would love to come out and do an IV for you, but we may not have any in stock at that moment. Just be patient with us. The other thing we can always do is give you an injection of a vitamin C, a B complex, something like that, B12, that will help you to feel a little bit better and to prevent certain other types of illnesses. So the obvious question, does this cost more? Yes, of course it does. We charge our fees based on a couple of things. One is the time required for the visit, and for a new patient, that's anywhere from $75 to $200, and it's based on the complexity of the visit. If you are an established patient, you know that the fees are a little bit lower for established patients than for new patients. We charge also based on special services or treatment. So if we give a medication injection, that's typically going to be in that $25 to $30 range per medication. If we do an IV treatment, that generally starts at about $175. Sometimes we get a little bit of a break from the compounding pharmacy and we can pass that along to you, but generally it's about $175. Again, it's because of our cost in getting it in from the compounding pharmacy. The third fee is going to be the travel. And so we can't obviously see a patient out on a house call and complete that and then 5 minutes later see our second patient in the office. So we've got some travel things that we have to take care of. And so we charge a fee that ranges from $50 to $75 for the travel expense of us coming out to see you. You have to consider whether the convenience of us coming to you is worth that little extra fee. So we do not bill insurance, your health insurance, we do not bill Medicare, we do not bill Medicaid. We are happy to provide you with a super bill that you can try to get reimbursement from your third-party payer, but we do require fees at the time of service. We'll take checks, we'll take your credit cards, debit cards, even health savings account card. Bear in mind that while cash is legal tender in this country, and my bookkeeper hates it, that's okay, we'll even take cash, but we do not carry cash to make change, so you'll want to have the exact fee if you want us to accept your cash. You can schedule an appointment online at coppervalleymedical.com or drdonselby.com. Either one of them has an appointment scheduler, and you can look on the appointments and see when we can get you in. Now, bear in mind, if we've got travel time, do not try to squeeze yourself in between a couple of other patients that are in the office. We'll have to reject that one. You can always call us, which might even be the best thing to do, and then we can talk about what's going on and why a house call is the best option for you. You can always send us an email. info@coppervalleymedical.com is encrypted, so we should be able to keep that private from any kind of hackers. And again, we just want you to be reasonable when trying to make an appointment for us. So one final thought, we just cannot come to your residence for a house call if you are there all alone. We ask that you try to find a caregiver, family member, friend, neighbor, whatever, to be there with you while we're there. Otherwise, tell us and we'll need to find a staff member that is willing to come along on a house call. And I'm sure you can understand in this modern era why it is that we just don't have a doctor come to your house alone. It's just not worth it to us. Anyhow, we do make house calls. We hope that we don't ever have to see you at a house call. But if you need us, we're there for you. I'm Dr. Don Selby. Thanks for watching. Thank you. Bye-bye.